Okay, we're going to look into the practicals for GM, so MSK Module 2. So the first image is on osteosarcoma. So you can actually see this is actually the proximal part of the tibia, and you can actually see there is actually a tumor that in growing from the medullary cavity, right? So this tumor is involving the diaphysis and metaphysis here, and you can actually see that the tumor has features of malignancy such as um, very not well defined margin, and you can actually see the cut surface is heterogeneous with areas of hemorrhage and necrosis. Okay, next is on chondrosarcoma. Similar, this is actually in the humerus. Okay, the distal part of the humerus. So you can actually see there's an intramedullary tumor there with all the malignancy features such as poor demarcated margin, but most importantly that this tumor has this grayish whitish cartilage like tissue, right? And definitely because this is a malignant tumor, you can actually see areas of hemorrhage and necrosis there and there. All right, okay. Next is metastatic carcinoma. This is actually the vertebra. So in this vertebra, you can actually see there's multiple small lesions. Okay, these multiple lesions are basically metastatic lesions that actually originate from other organs, right? And because of this is also still a malignancy, it has heterogeneous gut surface with areas of hemorrhage and necrosis. Next is osteoarthritis. This is actually the head of the femur of a patient with osteoarthritis. You can actually see that the surface of the head of the femur is actually very granular, and in area you can see almost an ulceration, meaning that there's actually loss of cartilage lining, and some of areas of the cartilage become so shiny, right? So shiny, this is what we call as hibernation of the cartilage surface, and because of loss of the cartilage lining, you can actually see exposure of bony surface there. Okay. Next is clinical features of rheumatoid arthritis. So basically, commonly seen in the hand, you can actually see that the fingers are practically swollen, and there's an ulnar division. This is ulnar region. The hands move towards this area, and there is actually a swan neck deformity. If you see from the side, so basically the finger becomes like this, right? But another deformity that is associated with rheumatoid arthritis is boutonniere deformities because of the prominence of the MCP, right? And this is what we call as boutonniere deformities. Next is gouty arthritis. This is easy because you can actually see one of the most common area is at the CP joint, distal phalanx, and you can actually see that there is actually redness of the joints, and you can see there's actually yellowish features near to the skin, and these are what we call as tophi. Next is squamous carcinoma, a malignancy of the skin. It features like this. You can actually see there's actually a tumor there, and the tumor has central areas of ulceration, and the base is actually very dirty. Dirty meaning that it has areas of hemorrhage and necrosis, and most importantly, the margin is actually what we call as rolling. Okay, it appears 3D. Next is basal cell carcinoma. So in this tumor, compared to the previous one, does not have any ulcer so much, but the tumor has a poor demarcated, well circumscribed margin compared to any other malignancy, but the surface has almost like a pearl appearance, so what we call as pearly surface, whitish pearly surface, and most prominently, the tumor has a lot of prominent blood vessels at the tumor surface. Next is melanoma. So grossly, melanoma has all the 5 features of A, B, C, D, E, A, B, C, D, E, and most importantly, it's actually a blackish lesion. It's a flat lesion and has a poorly demarcated margin. Okay, and most importantly, it is asymmetry. It's not same right and left, or even down and below. It's not symmetry. It has irregular borders, as I said before, and the color is heterogeneous. Some of it are very dark, some of it are very light. Okay, and the diameter is usually more than 6 millimeter. Okay, we are going to look into virtual microscopy slides. First is osteosarcoma. So when you open the link, it will open like this. Focus on this area. Okay, so when you focus on the area, you can actually see there's a lot of cells that has features of malignancy, such as hyperchromatism, increased IC ratio, and pleomorphism. And these are actually what we call as malignant osteoblasts. And near to this malignant osteoblast is this pinkish material that known as osteoid. So malignant osteoblasts that produce osteoid is seen in osteosarcoma. Next is chondrosarcoma. So when you look into this image, focus on this area, whereby you can actually see the cells that you can see here are actually like cartilage cells, but the difference is all these cartilage cells are having malignant features such as pleomorphism, hyperchromatism, and each of these cells produce this material known as cartilage. So this is chondroblastoma. Next is this image. When you open the link, you can see there's a strip of bone there, and in the bone you can actually see the bone trabeculae, but inside there you can see there's actually a malignant gland. So this is actually an intestinal malignancy that goes into the bone marrow. Next is Gouty arthritis. So you can actually click the link and open this image. You can focus at any area and you can actually see that the pinkish material. There's a lot of these areas of pinkish material, and this is what we call as tophi. Surrounding it are these inflammatory cells, mainly lymphocytes, and there are multiple foreign body type giant cells. Okay. Next is squamous cell carcinoma. Focus on this section, and you can see there's actually a tumor within the skin, and there's all the 5 features malignancy of the cells. This is what we call as malignant squamous tumor, and most importantly, the thing that you see here is what we call as keratin pearl. Next is the tumor inside the skin, basal cell carcinoma. So this is the skin. This is in the dermis. You can see there's actually a tumor there. It forms nodules. Okay. In low power, this is the only malignancy that does not have all the features of malignancy, because it is monomorphic, it is not hyperchromatic, and doesn't have any increase in NC ratio. The only difference that is this derangement, and you can see at each nodule it appears that it actually is stacking to each other. This is what we call as peripheral palisading, and in between the nodules you can also see cleft there. Next is melanoma. So this is actually a skin, and you see a tumor inside the skin. Focus on this brownish area, because when you look into there, there's a lot of cells that has all the 5 features of malignancy, such as hyperchromatism, pleomorphism, high NC ratio. But most importantly, in the cytoplasm of all the cells, you can see the brownish pigment. Those are melanin. Therefore, the malignant cells are basically melanocytes. So this is a feature of malignant melanoma. That's all. Thank you.